Let's face it, there's a lot you don't know about sickle cell disease.
Like that it affects almost all races.
Like that it affects millions.
That it can be unbearable.
That it's the most common genetic blood disease in the country.
But awareness and understanding are still far too uncommon.
Let's face it, there's a lot you don't know about sickle cell disease.
And that's a disease too.
Call the 211 info line to learn more.
Hello, welcome to another segment of Face Sickle Cell. My name is Virginia Patiller. I serve as Executive Director for Citizens for Quality Sickle Cell Care, Northern Connecticut chapter. And today we're going to be talking about sickle cell. And I have with me a very special guest that I have the pleasure of introducing to you. Her name is Geniice Nelson. And we're going to be talking about sickle cell and what she does and the role that she plays in the movement of sickle cell disease. And now I would like to introduce to you Geniice Nelson.
Hello. Thank you for having me, Virginia. How are you today?
I am doing wonderful. How are you doing?
I'm good. Blessed.
Amen. Me too. And it's so interesting to talk about being blessed because, you know, with sickle cell, I run into a couple of people who, in spite of that disease, say they're blessed. So I want to talk today about what actually is sickle cell disease.
Okay. Well, sickle cell disease is an inherited red blood cell disorder. It was one of the first genetic disorders that was discovered about 100 years ago. And in sickle cell disease, what happens is your red blood cell becomes misshapen or can sickle under different circumstances, usually stress, emotional sickness, low oxygen, and it causes severe pain. Along with causing severe pain, it also causes damage to your internal organs. So it is a very debilitating disease at times in people's lives. It can actually halt their lives because when they're in pain, when they're in a occlusive crisis, when these red blood cells are sickling, they're not doing anything else. They're trying to recover from this painful episode.
So how does one get sickle cell?
It's a disease that you're born with. So what typically happens is you inherit your genes from your parents. So you receive one gene from your mother, one gene from your father. And anything that's abnormal, these are called hemoglobinopathies. It's a big word, but what it means is that the hemoglobin in your blood, which carries the oxygen, is affected. So if you receive a sickle gene from your mom and a sickle gene from your dad, then you have sickle cell disease. So for people who have sickle cell trait, that's how you pass this genetic disorder onto your children. So for people who have this trait, it's important that they know, so that they know what possibilities of genetic diseases they're passing on to their children. So we encourage people to get tested. Usually it's free at either of the organizations. There's two, the one that you mentioned, and then there's one, Sickle Cell Disease Association of Southern Connecticut. But you can also get tested at your doctor. You can get tested at the health department. These screenings are free, and it lets you know, do you have an inheritable disease that you could possibly pass on to an unborn child.
And who actually gets sickle cell disease?
Well, in America, typically what you see is that it affects primarily African Americans and Hispanic people. But sickle cell disease truly is a global disease. We look at it and we treat it locally, but it's a global issue. The World Health Organization has mandated that the world look at how sickle cell disease affects individuals. There are pockets in America, of course, where there are large numbers of African Americans or people who are of Turkish descent, Sicilian descent, that have sickle cell disease. Primarily here we see African American and Hispanic, but truly it is a worldwide sickle cell disorder.
What is it that, and we didn't go into you introducing exactly what it is that you do, but would you take time right now and just talk about what it is that you do on behalf of sickle cell disease?
I'm a nurse practitioner, so I have been prepared to, and I have a license to diagnose and treat illness. So what that means is I am not a doctor. I do work very closely with a physician. We have a collaborative relationship. But I am able to see patients on my own. I am able to diagnose whatever problems they may have. I am able to write prescriptions for them for their treatments, be it medications, be it x-rays, be it physical therapy, whatever their treatment will involve. I also, for sickle cell disease, treat those patients when they're in vaso-occlusive crisis. Pain management is a very important part of what it is that I do. I work at UConn Health Center, where we have a comprehensive sickle cell center. So I work very closely in the outpatient department, managing them when they're well, managing them when they're sick. We bring them in to the infusion room for pain management treatment. When they're hospitalized, I'm also involved in that aspect of their care too, to help make recommendations for their pain management and other issues that they may have, because sickle cell, just because they have sickle cell disease doesn't mean that they don't have other illnesses. As people live longer with sickle cell disease and we get older, we all know that we're at risk for being African American, diabetes, hypertension, obesity. So all of those things also occur in people who have sickle cell disease as well.
So let's talk about the newborn screening, because there are many of us who were born before the 1990 inception of the newborn screening. What actually happens with newborn screening?
So when a baby is born in any hospital, well, in any hospital in the state of Connecticut, they are given a series of tests when they're born. So they do a heel stick, you know, they prick their heel like you would stick your finger, get some blood, and it's sent to the state lab. The lab runs tests on it and determine if they have any genetic diseases that could cause problems for them. And there's about 40 different diseases that they actually check for, with sickle cell being one of them. If that test does come positive for sickle cell disease, if the family has listed when the child is born that they have a pediatrician, that information is sent to the pediatrician, and the parents of that child are also notified, so that they can come in, so that they can find out what it is to me, what it will mean to them to have a child with sickle cell disease.
Does that apply for the trait? So if a baby is born with a trait, what happens there?
Okay. People are notified in the same manner that their child has sickle cell trait, but it's imperative that they notify those that have disease, because there are things that will happen in that child's life. So there's greater effort to notify those who have disease. People who have trait, the pediatricians are notified if they've listed a pediatrician when the child is born. They also send certified letters to the families to bring them in to tell them what it is that they mean, what it is. Sickle cell trait is just that. It's a trait. They do not have disease. It will not turn into disease. It will only be disease if they pass it to an unborn child. It will never manifest as a disease within that person who has sickle cell trait.
Now, I've run into many people with the trait, and some people think that they do have some symptoms of sickle cell disease.
I've also run into that, but there's no scientific evidence that proves that that holds true. The military did 2 very extensive studies with over 1 million individuals that had sickle cell trait to see. If you join the military, you know that's stress. You're going to be out carrying heavy packs. You're going to be doing all this work. So what the military did was they took these individuals who had just general population, and they treated them all the same. What they did was they made them rest at certain intervals, they made them hydrate at certain intervals, and they found that in that population of 2 studies with more than 1 million individuals, that whether you had sickle cell trait or not didn't cause any problems, as long as you were allowed to rest and hydrate at certain intervals to keep you from having a problem. So I do understand that people who have sickle cell trait, there are a few that say, you know, I do have aches and pains, you know, I do have some shortness of breath. I understand that those people have those manifestations, but there's no scientific evidence that suggests that having sickle cell trait will cause you any symptoms of sickle cell disease.
I see. So let's move a little bit into the comprehensive sickle cell clinic, because I know that's where you're working, and I think a lot of people don't even know we have a clinic at UConn. So can we talk about that?
Sure. So at UConn Health Center, under direction of Dr. Brian Damariam, we have a full comprehensive team. So there's Dr. Brian Damariam, there's myself as the nurse practitioner, we have a dedicated nurse, Neri Farrington, and we also have a social worker who's a mental health counselor, Teresa Works. So the four of, that team also includes you as a navigator to help them with some of their housing issues and other social issues. So as a comprehensive team, when we go in on a weekly basis, we're able to assess them physically, we're able to assess them mentally, we're able to address some of their psychosocial issues, so that we're not just treating an individual who may have pain, but we're treating an individual who may have pain, who may also have housing issues, who may also need some counseling because they're having some other social issue, who may need some navigation through some of their insurance problems. So, we're as individuals, regardless of whatever our health status is, we have more than just our disease, or more than just, I'm a nurse practitioner, excuse me, my eyes are watering, but we need to take care of the whole patient. So our program really focuses on trying to take care of the whole patient where they are when they come into us.
That's great. Now, being that sickle cell disease is an invisible disease, what are some of the symptoms that people experience when they're having pain crises?
Okay. Well, with sickle cell disease, pain is the hallmark symptom. Some of the other complications that people can have from sickle cell disease is they can develop what's called pulmonary hypertension, which, we know that hypertension is we have high blood pressure in our veins. Well, you can also develop high pressure in your lungs as a result of having sickle cell disease. It can affect your heart. It can affect your eyes and can cause blindness. It can affect your kidneys. It can affect your liver. Sickle cell disease can affect every part of your body. One of the other major complications that people who have sickle cell disease has is that it causes bone death or avascular necrosis. And what happens is when you have blockages that occur in your body over and over again, because typically when people have sickle cell pain, they have them in the same place, their arms, their back, their legs. But when you can continue to have these crises, these pain events over and over again in the same part, and there's blockages that occur, it causes tissue death. So when tissue death occurs, your bones are essentially in certain areas are dying, can cause people as young as 20 years old to have a knee replacement or a hip replacement. There's a high incidence of gallstones because your red blood cells are constantly being broken down. And so when that happens, you have bilirubin that spills out into the blood, so that can cause you to have gallstones. So it's not uncommon for 15, 16-year-old individuals to need to have their gallbladder removed. When they're a little bit younger, some of the effects are they have what's called dactylis, or hand-foot syndrome, where their hands and their feet will swell because the blockages in those tiny blood vessels has caused their hands to swell enormously. It's red, it's hot, and it's very painful. So you have a child who may be in pain, and our instinct is we have a child who's in pain that you're going to pick them up to help them. But for that child, the best thing is probably for you to not touch them because they're in pain. So there are a lot of, unfortunately, things that can happen. Sickle cell disease is a progressive disease, and as individuals live longer and longer into their 40s and 50s, they find that along with having their sickle cell disease, then they do have some of those other issues that I mentioned, the hypertension, the diabetes to deal with, so they have more than one chronic illness.
Okay, there's a lot to talking about sickle cell. Being out in the community, I hear a lot of people saying, "Oh, we're still talking about that. I thought that was a done thing that we've," and I'm like, we're still talking about it, because what about a cure? When we talk about a cure, where are we with that?
Well, when we talk about a cure, there's no cure that's readily available to the general population of individuals who have sickle cell disease. But there is a cure in having bone marrow transplantation. So in saying that, bone marrow transplantation is still very experimental. right now, bone marrow transplantation occurs when you find individuals in their families who can match them. So you have to have a sibling match, meaning you have the same mother, same father, you have the same genetic makeup, because when you have a bone marrow transplant, what essentially happens is you take an individual who has sickle cell disease, you have to put them in a protected environment, and you kill off their sickle cell disease through medications, which is in their bone marrow, because your bone marrow produces your red blood cells. So when you have someone who has a bone marrow transplant, now you've harvested from their brother or sister, whoever matched them, their bone marrow that does not have sickle cell disease, and now you have to put it into this patient and pray that this transplant takes, because there are individuals who've had a transplant that doesn't take. We fortunately have had one individual in our program who's had a transplant successfully and no longer has a sickle cell disease.
Is the process a long process for the bone marrow transplantation?
It is, because again, you have to take this person and put them in a protected environment, because your bone marrow protects you from infections. It gives your body the ability to fight off, somebody comes past you, sneeze and cough, it gives your body the ability to fight that off. So someone whose bone marrow is suppressed or has been killed off is now in a very vulnerable situation, especially in a patient population where infections can be very life-threatening. So you have to keep them in a protected environment for an extended period of time until that bone marrow suppression is killed down to the point where they can now have the bone marrow transplant. Then you give them the bone marrow transplant, and while you're waiting for this transplant to take, you still have to keep them protected from opportunistic infections, colds, pneumonia, any of those kinds of things, because they're still in a very weakened condition. So while you're waiting for them to recover to see if that bone marrow transplant is actually going to take and cure them of their sickle cell disease. So yes, it's a process. It can take a couple of months.
Okay. We were doing a training the other night with foster parents, and one of the foster parents said, when we were talking about the bone marrow transplantation, that her understanding was that you had to be a certain age to be a candidate. Is that true?
Well, they were finding that in younger children, they had a better chance of the transplant taking and healing. There have been, again, I work only with adults, adult person who's had transplant and it took and is doing very well. They typically want to do it on younger people, but the research is still going on. There's a study down in Maryland with the National Institutes of Health, the NIH, where they're trying to find people who don't necessarily have a full sibling match, meaning the same mother and father, but may have what's a half sibling. Maybe they share the same mother or they share the same father, to see if they can find enough genetic markers that will make that bone marrow transplant work for them. So the research is ongoing, that they're trying to make bone marrow transplantation available to sickle cell disease community, and right now that's pretty much all there is on the horizon for a cure for sickle cell disease.
So we're still looking and searching for a universal cure.
Yes, we are.
That will, as you would say, touches more the general population of people that live with sickle cell disease.
Yes.
Well, I want to touch on, what would you say to individuals and families who are living with sickle cell disease? How can they get engaged or become more involved in the movement? Because certainly we have a lot of work still to do. What would you say would be some of the things that people can do to get involved?
Well, typically when a child has sickle cell disease, their parents or their family unit is much more involved in their care. When they transition over to adult care, their family seems to back off and kind of, take a step back, and they're not as involved. But I would challenge them that they need to remain just as involved. They're not primarily responsible for that individual's care anymore because they're not a child, but they still need their support. They still need the advocacy. They still need to help educate the community around them, those doctors, those providers, those individuals that they go to school with, their church members, that this individual has sickle cell disease, but it doesn't mean that they don't have a full life. It doesn't mean that they're not a productive citizen.
Absolutely.
And the more people that we can get this message across to, that they have sickle cell disease, and when they're in pain or when they're sick, they need assistance for that episode. Once that episode is over, they're a productive citizens just like you or I, and we need to empower everyone around them to know that calling them a sickler is not the way to go, because they're not sick all the time. They're just, there's an event in their life that happens more frequently than some others, and then just keep it moving. So I would say, become involved in their care, wherever that care is. Have meetings at church. Go out to community events. You know, speak to people positively about sickle cell disease, because any person who's touched by the life of an individual who has sickle cell disease has something positive to say about what's going on with them.
Absolutely. I thank you for that. The population of young people that our organization really love to touch bases with is like middle school, high school, because we know that a lot of young people make decisions and, you know, they don't think about consequences until way after. So could you just give a word of encouragement to some young people right now about having sickle cell disease, but in spite of it, what they can do with their lives?
In spite of having sickle cell disease, that's interesting. What I've learned from individuals, and I've heard them say more than once, is that, you know, I have sickle cell disease. Sickle cell disease does not have me. And regardless of what your situation is, as long as you realize it's just a situation, it's just a circumstance, that it doesn't have to overshadow everything that you do. If you have a goal, if you want to be a nurse or a social worker or an actor, any of those things are possible if you figure out a plan how to get there. What you have to incorporate into your plan is that you do have pain events. And as long as you work that into your plan, okay, I have pain events. So when I have pain and I have to study, I'm going to get my hydration, I'm going to take my pain medicine, I'm going to rest, or I'm going to eat better, because, you know, younger people don't necessarily eat as well as they could, you know, because that's what typical teenage life is about. But it doesn't mean you can't achieve anything. More than half of the individuals that I am a partner with them in their care are in college and are very successful. Many of the people that we work with are professional individuals who have jobs, who have homes, who do all of those same things that we want to do. I mean, you have to remember, there are individuals out there who don't necessarily claim that they have sickle cell disease, but they're actors, they're actresses, they're not athletic superstars, because the nature of sickle cell disease might not allow them to be able to do that. But the sky truly is the limit if that's something that they want to do. All they have to do is set the goal in their mind and make a plan, and have the people around them help them and support them, and they can reach that plan, that goal.
And on that note, I would like to say that one young lady decided that she would go on to school. She got her bachelor's, she's gotten her master's, but she was told before she tried to even go towards any of those by an individual that she would not be able to do it. So I want to just stress as we close, I want to first thank Ms. Geniice Nelson for coming today and being a guest on this show. But I want to stress to those who participate in the care of people with sickle cell disease is that encouragement is perhaps the best thing that you can do with them right now. Education is the best thing. I find that parents are the best educators when they find that they have a child that was born with sickle cell disease. They start doing their own research. You don't have to be silent. You don't have to suffer in silence. There is an organization such as ours where you can come and you can be you can volunteer, you can give some time, you can come and answer telephones. Any of those things are open to you. So on that note, we would like to say thank you so much for tuning in to Face Sickle Cell. And if you ever look on our internet website, it is www.cqscc.org. If you would like to call our office, it's 860-223-5555. 7222. We enjoyed having you today, and we enjoyed our guests. We've learned a lot today, and we hope that you will come again and spend time with us as we face sickle cell disease. Thank you.